Where am I? Who am I? This is the cause of the silent brain killer, dementia, the disease that has affected over 55 million people worldwide and is one of the leading cause of disability and dependency among the elderly. According to the World Health Organization, dementia is the seventh leading cause of death globally. You might think that, oh, don't worry, I'm still young. But dementia starts out decades before the first symptoms even appear. It starts out by affecting the neurons in our brains. Today I'm going to talk about the 7 signs of dementia that you should not ignore, and 8 classic symptoms of dementia. Could your sudden change in behavior be one of them? What causes them? And scientifically proven tips on how you can prevent dementia or manage them. We will also talk about the latest research and development on this disease that have emerged in recent months. Dementia was incurable a few years ago, but we are coming close to the light of the tunnel, and doctors and scientists alike are hopeful that humanity is closing to the end of this devastating disease. If you or your family is suffering from forgetfulness or has a history of dementia, it is worth to watch to the end. First, please like and share this videos to your friends and family. YouTube will distribute this video to the right people, the people who do not have access to doctors, hospitals, or the right knowledge to combat these diseases. By sharing, you are helping in the effort to combat and ending dementia once and for all. Please also share with us some experiences you have had with these diseases. I believe that sharing knowledge is what we need to end not only dementia, but all types of diseases. That is why this video is created. Let us know, have you been having any symptoms? Where are you from? Are some people more susceptible to this disease? Let us begin. First of all, what is dementia? Dementia is a general term for several diseases that affects a person's cognitive ability. That is the person's mental capabilities to remember something, either what they recently did or the things that they have did in the past, to learn new things, reasoning, paying attention, solving problems, making decisions, or even performing daily activities. It is because of our brains that defines who we are. It shapes our personality, stores our memories, and powers our abilities to think, feel, and create. It's not just a biological marvel, it's the essence of our humanity, influencing how we perceive the world and interact with others. With it, we not only survive, but we live and thrive. But dementia not only takes away the ability to live, but also to survive. Dementia slowly attacking your brain, deconstructing you piece by piece, making you forget what, when, why you did something, to forgetting where or who are you, taking away everything until you are a shell of your former self. Dementia is a neurodegenerative disease where it attacks neurons in your brains, making them die at a faster rate than normal aging. Therefore, dementia is not part of normal aging. Without dementia, you can live past 100, and you would still remember everything. While with dementia, you may be 40 and you can forget everything you did today. There are several types of dementia, but the most common one is Alzheimer's disease, which accounts to 60 to 80%. Alzheimer is a type of dementia. So don't get confused when someone says Alzheimer is a separate sickness with dementia. Alzheimer is dementia, but dementia is not necessarily Alzheimer. Next type is Lewy body dementia and Parkinson's disease dementia, where abnormal deposits of a protein brain categorized as Lewy bodies affect chemicals in the brain whose changes, in turn, can lead to problems with thinking, movement, behavior, and mood. Then there is the vascular dementia, where this is caused by damage from restricted blood flow to the brain. Pick's disease, also known as frontotemporal dementia, is a rare type of dementia that causes progressive brain damage. If you have Pick's disease, you will experience abrupt changes in personality and behaviors, as the areas of your brain that control these are damaged. So what are the 8 early signs of dementia? First signs is postural changes. Postural changes might be quite difficult to detect, as this may also be a sign of aging, but these postural changes may be more apparent in relation to muscle weakness due to aging, altered gait which manifest as slower or shorter steps, dragging their feet or difficulty balancing themselves, and also coordination problems like fine motor skills, such as using utensils, holding a spoon, or performing tasks that require precision, such as cutting vegetables, becomes difficult. The person will also be leaning to one side or increase stooping. As the part of the brain that controls one side is damaged, they might need to be more dependent on the other side. These changes may also result in falling down, much due to lack of coordination. These may be subtle signs, but you may be able to differentiate them. These signs are more related to lack of coordination and not the usual muscle weakness due to aging. Second sign is sleep problems. Sleep problems are signs of dementia and can manifest in several ways. You may experience insomnia, struggling to fall asleep or stay asleep throughout the night. Daytime sleepiness is also prevalent, with individuals feeling excessively tired and needing frequent naps. Fragmented sleep, characterized by waking up multiple times during the night, disrupts sleep continuity. Vivid nightmares or intense dreams can contribute to disturbed sleep patterns as well. Restless leg syndrome, causing uncomfortable sensations in the legs and an urge to move, further complicates rest. Additionally, sleep apnea, marked by interrupted breathing during sleep, leads to frequent awakenings. These sleep disturbances can also worsen cognitive decline and behavioral symptoms in dementia patients, worsening the disease. Third sign is language difficulties, often manifesting as trouble finding the right words during conversations. Individuals may experience something called aphasia, where they substitute incorrect words for the intended ones, or struggle to recall familiar terms altogether, like going to the kitchen when they actually mean bathroom. This can result in frequent pauses, disrupted speech and frustration, the inability to name everyday objects or remember people's names. Even those they know well becomes apparent. Such challenges in verbal communication not only hinder day-to-day interactions, but also impact the person's confidence and social engagement. Early detection with the combination of these signs are key to preventing the progression and fight this disease. Fourth sign, apathy aka anhedonia. Do you remember someone who once enjoyed various activities, such as dancing, playing sports, socializing, suddenly show little to no enthusiasm or engagement anymore? They might withdraw from family gatherings, abandon hobbies, and become less involved in daily routines. This sign can sometimes be misinterpreted as depression, but in dementia, it is often due to changes in the brain's chemistry and function. Depression and dementia both involve changes in brain chemicals, but the difference is dementia also has abnormal protein buildup and significant nerve cell damage. Dementia usually shows chronic brain inflammation and death of neurons, whereas depression involves temporary, stress-related changes in neurotransmitter, like serotonin, norepinephrine, dopamine imbalances. Recognizing this shift in behavior is crucial for early detection and intervention. Fifth signs, muscle weakness. Did you know that dementia due to Alzheimer is more common in women than men? Dementia due to Alzheimer's disease is indeed more common in women, accounting for about 2/3 of all Alzheimer's cases. While part of this is because women generally have a longer lifespan than men, which gives them a higher chance of developing the disease as they age. But there are also other factors at play. Research suggests that hormonal differences, particularly the drop in estrogen levels after menopause, might increase the risk of Alzheimer's in women. Muscle strength is related to Alzheimer's as well. A study in the University of Sydney shows that strength training can help protect the brain from degeneration. Edith Cowan University in Australia have also found evidence suggesting a loss of muscle strength may also be a signal for older people developing dementia. Sixth sign, sensory problems. Have you ever tried walking up or down a stair and suddenly feeling unsure about your steps, as if the ground beneath you has shifted? That may be a sign of sensory problem caused by dementia. Individuals may experience sudden changes in depth perception, making it difficult to judge distances, which can affect their ability to navigate environments safely. Taste and smell can also be affected, starting to not sense smells or taste something that other people can. This is because the disease damages the brain regions responsible for processing sensory information, disrupts how the brain interprets signals from the senses, leading to issues like altered taste and smell, impaired depth perception, and increased sensitivity to noise. But in contrast to them, they will also have trouble hearing. It might be contradicting, but it is possible, as the disease affects different parts of the brain that process sound and control how we react to it. While some patients may struggle to hear certain sounds or distinguish words, they might also find loud noises overwhelming or distressing due to altered sensory processing. Seventh sign, reduced ability to plan and finish complex tasks. This impairment is due to the progressive decline in executive function, a cognitive process that enables us to manage and coordinate actions towards achieving a goal. As the disease progresses, the ability to sequence tasks and maintain an overview of steps diminishes. Additionally, individuals may have trouble adapting to new routines or changes in their environment, further complicating their ability to plan and organize. This decline often leads to increased reliance on others for assistance, with daily activities from managing medications to organizing social events. Now that you know the early signs of dementia, let's move on to the more specific and advanced symptoms. Symptom 1. Misplacing items in inappropriate locations. It's very common to misplace an item, but those with dementia may place things in very inappropriate locations, like putting car keys in the fridge. It may be normal to place them in weird places like that sometimes, but without any other reason to open the fridge other than to put the key. You will need to worry. Symptom 2. Hallucination. Hallucinations are a classic symptom of dementia, where individuals may experience sensations that have no real source. For example, a person might see people or animals that aren't there, hear voices or sounds that others don't hear, or even feel physical sensations that are not real. These experiences can be frightening and confusing for both the individual and their loved ones. Hallucinations are a result of the brain's deteriorating ability due to dementia to process sensory information accurately, leading to these false perceptions. Symptom 3. Trouble with abstract thinking. Individuals with dementia often face significant challenges with abstract thinking, which affects their ability to think clearly and logically. They might find it difficult to understand concepts that aren't concrete when told to them because their minds tend to wander, making it hard to stay focused on a task. For instance, when asked a question, they might skip over it or give an unrelated response due to a combination of confusion and forgetfulness. This can make even simple activities like planning a day or understanding instructions incredibly frustrating and challenging. Symptom 4. Mood swings. A person who was once calm and cheerful may suddenly become irritable or agitated without any clear reason. These emotional changes can happen rapidly and can be very confusing for both the individual and their loved ones. Heightened emotions, such as sudden bouts of anger, sadness, or anxiety, can occur frequently. These mood swings are not just reactions to external events, but are often a result of the brain changes caused by dementia. Symptom 5. Inability to recognize familiar faces or places. This is one of the most heartbreaking symptoms. A person may struggle to identify family members, friends, or even their own home. This can be distressing for both the individual and their loved ones. They might also mistake a stranger for a family member, which may be dangerous when the stranger has bad intentions. This symptom reflects the deterioration of the brain regions responsible for memory and recognition, leading to significant confusion. Symptom 6. Repeating questions or statements frequently. A common and frustrating symptom of dementia is the frequent repetition of questions or statements. Due to short-term memory loss, individuals may forget that they have already asked something and will ask the same question again and again. This can be challenging for caregivers and family members, as it requires constant patience and understanding to respond to these repeated inquiries. Symptom 7. Disorientation. Disorientation is also a hallmark symptom of dementia, where individuals often become confused about time, place, or their surroundings. They might forget what day it is, or even what year, and may struggle to recognize familiar locations. For example, a person with dementia might leave their home for a short walk, and then be unable to find their way back. Or they could arrive at a long-known place, like a favorite park, and suddenly not remember where they are. Therefore, once it reaches this stage, there should always be a caregiver monitoring them. Symptom 8. Loss of urinary or bowel control. This might manifest as frequent accidents, or an inability to recognize the need to use the bathroom. For instance, a person might urinate on the floor, or forget to use the toilet entirely, even in familiar settings. Such incidents can lead to embarrassment and discomfort, impacting their daily life and independence. This loss of control is often due to the brain's impaired ability to signal and coordinate bodily functions effectively, so they will need to wear diapers or need someone to keep track of their bathroom schedules. So what causes dementia? Dementia can have a hereditary component, but it is not solely determined by genetics. While having a family history of dementia may increase a person's risk, it does not mean they will develop the condition. Some types of dementia have known genetic risk factors. For example, certain genes can increase the likelihood of developing Alzheimer's disease. The most well-known gene associated with Alzheimer's is ApoE4. Most cases of dementia, especially late-onset forms, are influenced by environmental and lifestyle factors such as what we eat, what we do. For example, severe or repeated head trauma can lead to conditions like chronic traumatic encephalopathy, CTE, which causes symptoms like dementia. This trauma can also trigger inflammation and the accumulation of abnormal proteins in the brain, further raising dementia risk. Those who have stroke at some point of their lives also has increased risk of developing dementia. A stroke can damage brain tissue, leading to cognitive decline and changes in memory, attention, and executive function. The resulting brain damage from a stroke can impair blood flow and trigger inflammation, both of which contribute to the development of vascular dementia and other forms of cognitive impairment. People with diabetes and cardiovascular diseases caused by hypertension or blood clot can damage blood vessels in the brain and cause inflammation, increasing the risk further. People with HIV and depression also increase the risk, as these illnesses affect the brain directly. People who lack certain vitamins may also be at risk on developing dementia. Deficiencies in key vitamins can significantly increase the risk of developing dementia. Vitamin B12 is crucial for nerve function, and lack of it can lead to memory problems and cognitive decline. Vitamin B1, thiamine, is essential for brain health, with deficiencies potentially causing Wernicke-Korsakoff syndrome, which affects memory and cognition. Vitamin B9, folate deficiency, is linked to higher homocysteine levels, which are associated with an increased dementia risk. Vitamin D deficiency is connected to cognitive decline and a greater likelihood of developing dementia. While vitamin E's antioxidant properties may help protect against cognitive deterioration, making its deficiency another potential risk factor. On to the golden question: what can we do to prevent and manage dementia? Study from Finland-Finnish Geriatric Intervention Study to prevent cognitive impairment and disability, FINGER, found that multi-domain lifestyle interventions, which states that domains such as diet, physical activity, cognitive engagement, and social interaction, can maintain brain function and reduces the risk of cognitive decline and dementia. So the first thing we can do to prevent dementia, according to the study, is to increase your cognitive reserves. Cognitive reserves are the brain's ability to improvise and find alternate ways of getting a job done. It is the network and storage that you have gained throughout your life, like riding a bike, speaking a foreign language, or playing an instrument. It also reflects the mind's resistance to damage of the brain. Why cognitive reserves reduce the risk and impact of dementia? The answer is neural compensation. The brain can compensate for damage by using alternative neural pathways or networks. Having high cognitive reserves means you are able to use the many alternative networks instead of the damaged ones. Think of your brains as a library, and increasing cognitive reserves means gaining experience and skills in terms of books. Sometimes parts of the library can get damaged. For instance, if there's a leak in the roof, some books might get wet and ruined. This is like what happens when the brain gets damaged due to diseases like dementia. If your library is packed with tons of books, losing a few won't be as noticeable. You'll still have plenty of resources to draw from. In the same way, if your brain has a lot of knowledge and skills stored up, it can handle damage better because it has more backup options. The Nun Study, conducted by Dr. David Snowden, proven the concept of cognitive reserve and its protective effects against dementia and other brain pathologies. Initiated in 1986, the study involved 678 Catholic nuns from the School Sisters of Notre Dame, aged between 75 and 106. These nuns were selected due to their relatively similar lifestyles, apart from the development of cognitive reserves. After examining the brains from post-mortem examination donated by the nun after death for study, they found that nuns with higher levels of education and engaged with higher cognitive activities throughout their life were symptomless when found that they have developed dementia, as opposed to the nuns with lower cognitive reserves shown symptoms and worsen effects of dementia. Second is to engage in physical activity. Physical activity is always good for your body, be it your heart or your brain. Physical exercise promotes the growth of new neurons by increasing the production of brain-derived neurotrophic factor, BDNF, a protein that supports neuron survival and growth, particularly in the hippocampus, a brain region crucial for memory and learning. This process, known as neurogenesis, helps counteract the brain's natural aging and supports cognitive functions. As previously mentioned, building muscles can greatly reduce the risk of dementia and increasing overall life quality. As we age, contributing to the phrase, "A healthy body comes a healthy mind." Third, improve sleep quality. Always make sure you sleep at least 8 hours a day. The idea that older people naturally need less sleep than younger adults is a common misconception. So everyone, be it adults or older people, needs to sleep 7-9 hours a day. During deep sleep, the brain's glymphatic system becomes highly active. This system is responsible for clearing waste products and toxins that may cause dementia from the brain. Quality sleep helps reduce neuroinflammation and supports overall brain health. Fourth, manage your weight. Excess body weight, especially visceral fat stored around internal organs, can cause chronic inflammation throughout the body. This inflammation can damage brain cells and increase the risk of dementia. By maintaining a healthy weight through balanced diet, and regular exercise, you can reduce inflammation, improve physical health, and support overall brain health, thereby lowering the risk of developing dementia. Fifth, quit smoking and alcohol. Smoking has detrimental effects on lung and blood vessel health and can significantly harm brain function. It increases the risk of heart attacks, strokes, and dementia. Excessive alcohol can lead to brain cell damage, disrupt sleep patterns, and impair cognitive functions. Chronic alcohol abuse is associated with an increased risk of neurodegenerative diseases, including Alzheimer's disease. So moderate your alcohol and quit smoking to defend yourself against dementia. Sixth, control blood pressure. High blood pressure and cholesterol are not the direct causes, but indirect ones linked to an increased risk of dementia. Hypertension causes cardiovascular disease such as stroke that damages the brain, welcoming the attack of dementia. Managing these factors is vital for brain health. Statins, a medicine which help control cholesterol, have been shown to reduce the risk of dementia by approximately 15%. 7. Adopt a healthy diet. Diets such as the Mediterranean diet, Mind diet, and ketogenic diet have been shown to offer protective benefits against cognitive decline. These diets focus on consuming monounsaturated fats, fatty fish, and reducing refined carbohydrates, all of which support brain health and may help prevent or slow the progression of Alzheimer's. Fasting, including intermittent fasting and caloric restriction, may offer benefits for brain health and dementia prevention by promoting autophagy to clear brain toxins, reducing oxidative stress, and improving metabolic health. These practices enhance insulin sensitivity, support weight management, and boost brain-derived neurotrophic factor, BDNF, which aids neuron growth and cognitive function. 8. Control your blood sugar. Type 2 diabetes is associated with a higher risk of developing Alzheimer's disease. Type 3 diabetes refers to the concept that Alzheimer's disease may involve insulin resistance in the brain, impairing glucose metabolism and contributing to cognitive decline. Having type 2 diabetes triples the risk of developing Alzheimer's disease. It is important to control your blood sugar and reverse diabetes to reduce the risk of dementia. Some medications used for type 2 diabetes, such as insulin sensitizers, are being studied for their potential benefits in treating cognitive decline and Alzheimer's disease. Apart from our understanding and knowledge that can prevent and manage dementia, scientists and doctors are now hopeful than ever in ending this disease, because after so many decades there have been many developments in medicine and drugs to combat dementia. New drugs like lecanemab and donanemab target amyloid beta plaques and tau tangles that causes dementia, showing promise in slowing cognitive decline. Immunotherapies are being developed to enhance the brain's ability to clear these toxic proteins, while gene therapy and precision medicine aim to address the disease's genetic underpinnings. Advances in neuroprotective agents, combined with lifestyle and behavioral interventions, are also being explored. Improved early detection through biomarkers and blood tests is enabling earlier and potentially more effective treatment. The increasing investment and innovative research in these areas are fueling optimism that we may see substantial progress or even a cure for Alzheimer's in the coming decades. These drugs are new and expensive, so not many have access to them. But by spreading awareness and emphasizing the importance of curing Alzheimer's, we can drive research, reduce costs, and improve accessibility and investments to make these groundbreaking treatments more widely available, offering hope for a future where effective management and potentially a cure for dementia once and for all. Did you like the video? Remember to share it so more people have this awareness and knowledge to fight this disease. Don't forget to like, comment, and subscribe, and we'll see you in the next video.